Hello, freakazoids. I guess the autopsy, Justin Lum just put it out on the of Alex Cox. So let's just go over the autopsy right now. Alex Cox autopsy came out. Remember, Alex Cox is the individual who shot Charles Vallow at Lori's house. He claimed self-defense. I think it was totally set up. And then apparently on October 2nd, that same year, he's the one that Brandon Boudreau says he shot at him on October 2nd. He also moved to Rexburg, and then he married Zulima, and then he died like within a couple weeks after he got married. And the day after, Tammy Daybell's body was exhumed. Okay, so it's a little bit crazy, So now we are going to take a look at this. Oh, thanks, Jerica Killy. Killy, are you feeling killy today? Hey, boy. Let's see. Now you guys can't see anything at all at this point. Oops. I have the folder open, but I lost. There it is right there. Okay, here is the first page. It says the date of examination was 12/14, and I think he got married right around 12/29 or 11/29. So the autopsy was done on 12/14, and let's see. Let's go to the next page here. I haven't read this yet, so we're just going to go over it together. All right. So if you've read it already, do not comment in the chat, okay? Don't do it. It's not going to work out well for you. According to, let's see, endotracheal tube is producing from the, protruding from the mouth. So they obviously they left in the tube that was used to try to save him. The leads and pads are still connected to him. Bilateral upper arms and bilateral thighs. Defibrillator pads are overlying the anterior chest, and intravascular line is within the left antecubital fossa. Okay, so anyways, here's just describing how he showed up. Okay, the body is that of a 73-inch, 227-pound adult male of the stated age of 51. The scalp is covered with gray hair and male pattern alopecia. The eyes have hazel, let's see, I think it meant to say irises. It says iridis. Irises with slightly congested conjunctivi and scleria, which are otherwise free of, petechiae. I have no idea. I'm not going to look that stuff up right now. The nasal bridge and septum are intact. The external auditory canals are unremarkable. The oral mucosa is free of lesions. The maxilla and mandible have native dentition in good repair. The upper lip has hair in the form of a mustache. The mandible has stubble in the form of a beard with longer hair on the chin consistent with a goatee. The neck is symmetric and free of scars, injuries, or palpable masses. There is a cervical facial cyanosis. The chest is symmetric and also free of scars and tattoos. The abdomen is flat and no grossly identifiable scars or trauma. But this is the autopsy that was here's the thing. You gotta look at it like this. This is the autopsy that was performed the day that you know, just in the normal course of it. I don't know if this is a second look that they probably would have done given all the craziness, okay? So this is the original autopsy, all right? The back is symmetric and free of scars, injuries, or tattoos. The extremities are paired with feces adherent to the bilateral feet. The left lateral ankle has 2 1 centimeters abrasions. Huh, so he must have had like feces in his feet. The body is opened by a standard Y-shaped thoraco-abdominal incision. You know, you've seen the Y shape where they cut up the stomach and then Y shape and then they peel it open. That's how they did the alien autopsy, as a matter of fact, if you go look that up. All viscera and all viscera occupy their appropriate anatomical relationships. Subcutaneous adipose tissue ranges up to approximately 3 centimeters in thickness over the abdominal wall. Serous surfaces are smooth and glistening throughout. There is no significant free fluid accumulation in the body cavities. The 525-gram heart occupies its usual mediastinal site. The external configuration is unremarkable. The epicardial surfaces are smooth and glistening. All major vessels arise in their appropriate anatomical relationships. The coronary arteries arise normally and are distributed in the left dominant distribution with approximately 75 to 80% eccentric and concentric narrowing of the left anterior descending coronary artery. So it's saying that that one is 80%, 80% narrowing, meaning like it's close, it's pretty well blocked, it sounds like. Have approximately 50% eccentric and concentric narrowing of their lumens, the other side. The underlying myocardium is somewhat mottled, especially with the posterior septum, and is otherwise free of gross scars or evidence of hemorrhage. The myocardial thickness are 1.5 centimeters left ventricle, 1.5 centimeter interventricular septum. The cardiac valves have thin, pliable leaflets. The valve circumferences are appropriate to the caliber of the cardiac chambers. Yeah, this is pretty detailed. I'm not an expert. I mean, some of the stuff I recognize, some I don't. The valve circumferences are appropriate to the caliber of the cardiac chamber. Valvular circumferences 13 centimeters. Tricuspid valves 9 centimeters. Blah, you know, so it goes through. You know, I mean, pulmonic valve 12 centimeter. Mitral valve 8 centimeter. Aortic valve. The valve cusp and surfaces are free of fusion or vegetation. Vegetations. It does say that. I thought I read that wrong. The aortic is a normal caliber with all major arterial branches arising in their appropriate anatomic relationship. Elasticity is normal. The intimal surfaces have mild focal fatty streaks without aneurysm formation or dissection. No systemic venous abnormalities or thrombi are present. The vasculature of the lower extremities is dissected and reveals no evidence of thrombi. I'm not sure if, this part up here where it said 75 to 80% narrowing of the left, I don't know exactly what they're saying there. I mean, it kind of makes sense. Hey, thanks, Snow Remover. Appreciate it. And then also thank you. Yeah, I think I said thanks already to Jerica Killy up there. The lungs weigh 750 grams left and 800 grams on the right. The pleural surfaces are smooth and glistening. The bilateral lung parenchyma is, let's see, atelectatic. I have no idea what that means. Dark red, purple, congested with multiple You know, the funny thing is, even if you looked it up, you wouldn't understand it because the words they use in describing it are usually ones that you have to look up too. It's like the legal jargon, you know. That's why it's better to just have a doctor that they can literally just say, oh yeah, that just means. Anyways, respiratory system, we just went over that. Digestive, it's grossly normal and unobstructed. The esophagus is normal caliber with a smooth gray white mucosal lining. The esophageal junction is well defined. The stomach has intact mucosal surfaces, and the lumen contains 100 milliliters of dark red brown liquid. I wonder if that's like blood or something. Within the cardiac portion of the stomach, there is a, let's see, pedunculated nodule consistent with a gastric polyp with no surrounding inflammation, ulceration, or other abnormal present. The proximal, let's see, I don't know what, duodenum is notable for man, this is brutal. It's hard to, every single word is like a crazy, you know, what do you call it, medical terminology term. Hyperemia of the mucosa with no submucosal or serosal abnormalities. The remaining, so basically what they're saying in his stomach is that the only thing that was a little abnormal was the polyp that they found. Okay. The 2,175 gram liver has a smooth, intact capsule covering somewhat nutmeg congested, friable parenchyma with 3 distinct, fairly well formed dark red to purple lesions within the superior right dome of the liver. These lesions measure up to 2 centimeters in maximum dimensions and are most consistent with let's see, hemangiomas. The intrahepatic and extrahepatic ducts are patent and of normal caliber. The gallbladder contains viscidable, it looks like. Let's see, viscid bile, maybe. The gallbladder mucosa is grossly normal. Okay, now we're in the kidneys weigh 200 grams left and 200 grams right. The capsules strip with slightly difficulty from mildly granular, congested cortical surfaces. So what does it say? The urinary bladder contains approximately 30 milliliters of cloudy yellow urine. The mucosal surfaces are flat and pink tan. The trigone is patent. The prostate is notably enlarged and has fairly well circumscribed whorled nodules throughout the cut surfaces. The seminal vesicles are not remarkable. So he's got an enlarged prostate. Pretty normal for someone that age. The 410 gram spleen occupies its usual anatomic site with an intact, smooth, and glistening capsule covering dark purple, moderately firm parenchyma. Let's see. The thyroid and adrenal glands are grossly not remarkable, so they're normal. The neck. It's weird how they use grossly not remarkable. Like, they are so incredibly normal. You know? Like, just say they're normal. Why does it have to say grossly not remarkable? Meaning, you know. The cervical spine is structurally intact. The hyoid bone and thyroid cartilage. Hey, say hyoid bone 10 times fast. Tell me if you could do it. I could, Gray. I could, Gray.
Hey, Gray, I did it. I did really well. What about you?
No, I absolutely... Well, no, that's not me.
This is me right here. Yeah, I know. I know what gross means. It means like the full, you know, everybody knows, okay? It's just like, hey, wow, you know, just I wish medical terminology and legalese was a little bit more just sort of generic for everybody. Just say, hey, you know what? The spleen, the liver is, it's completely normal. I know they're not meaning like gross, like, ooh, you know, everybody knows that. You don't need to explain it. Hey, thanks, Kevin Brown. Yeah, this is the original autopsy. So I would take whatever's said on this one. It's just what they came up with originally, and then later on, I'm sure they probably did a way more extensive toxicology test. Now, livers are pretty gross. I'll give you that. Yeah, I know.
Thanks for all you do, Gray Hughes investigates.
I know where it comes from. I took classes in it, Discerning Light. I actually took a medical terminology class. I took linguistics. Yep, all the words come from Latin, and Greek. Almost all of them. Like you say polymorphic. Oh, it means many change, you know. Like that would, like morph means to change. Poly means many. If you see something that says itis, it means inflammation of. Okay? Carditis means, and cardio is heart, so if it's carditis, it means inflammation of the heart, right? Yeah, there's all kinds of stuff, really obvious. Yeah, there's always a little crossover here and there. Yeah. All right, so anyways, now we're down to here. The neck, the cervical spine is structurally gross intact. Grossly structurally intact. Okay. The cervical spine is structurally intact. The hyoid bone and thyroid cartilage are intact. There are no hemorrhages in the strap muscles or soft tissues of the neck. The upper airway is patent. I don't know what that means when they say patent. Do you know what that means? Discerning Light? And don't look it up really quick. You either know it or you don't. The upper airway is patent. Yeah, I know what the word is. It's patent. I just typed it in, Kyle. Okay, it means open. Okay. And somebody else said it means in good condition. Okay, it means open. All right. The bony framework supporting musculature and soft tissues are unremarkable. The axial and appendicular skeleton is normal. So everything's normal. Nervous system, the reflected scalp is free of trauma. A reflected scalp is when they peel the skin off of your scalp and then look at the underside to see if there was any bruising. Had you been hit in the head? They probably wish they could have done that to him when he was alive after he claimed he was hit in the head with a bat by Charles. I bet there was nothing there. The police, there wasn't even a bump. It was just a tiny little cut. If you get hit in the head with a bat, it's a big bump, and you would have seen trauma underneath there. Right. The Temporalis muscles are unremarkable. The calvarium and dura mater, that's the dura mater that we talked about in the Jodiarius case, and it says it's intact. So that means there was nothing that penetrated his head and went into the brain. The epidural and subdural spaces are free of blood. The 1600 gram brain has symmetric cerebral and cerebellar hemispheres, so it means it looks symmetrical. Covered by congested, clear, thin leptomeninges. The cerebral cortex is tan, uniform, and free of contusion or hemorrhage. The cerebral white matter is uniform throughout. So, I mean, it sounds like his brain's just fine, other than he's crazy, okay? It doesn't speak to your psychological well-being. It just means that physically, does it seem right? Yeah, he's got that's a big brain. That's Neanderthal. That's how my brain is. They measured mine one time and it was 1600 cc's too. So I think that's why it takes me so long to find information. Regular human beings are 1350, 1200 to 1400, and 1600 is about what the Neanderthals' brains were. So when you ask me a question, sometimes it takes a few minutes for me to retrieve it because it's so far away compared to you guys. All right. Microscopic examination. Heart, focally enlarged myocytes, and boxcar type nuclei, no evidence of inflammation. Left anterior descending coronary artery, severe arthrosclerotic and hypertensive narrowing. So very narrowing, like it was talking about, 80%. Lungs, large to medium arteries, occluded by well-formed focally organizing thrombi. Multiple vessels reveal recanalization with the adherent thrombi. No evidence of inflammation or polarizable material. Here's the thing, though. I mean, I know he had heart issues. I mean, you look at it, it looks like he's got... But it doesn't... The description of what he was going through doesn't match to me. I've never heard anybody with a heart issue going through the stuff he was going through. Oh, yeah, you mean with the brain? Yeah, I'm sure. No. No humanimal, no. It wasn't coronavirus. Nice try, though. You can go spread that rumor somewhere if you want, though. Yeah, I mean, foaming at the mouth, defecating on yourself. It just, I don't know. You don't see that a lot in heart. At least you don't hear about it. Anyways, let's see. Let's go to the last... Review the available reveals no significant abnormalities. A blood blot is collected and released. So I don't know. I don't know if he gives an actual... Here, hold on, let me check something really fast. Let me go check Justin Lum again. I like the final write-up is what I'm looking for. Yeah, see, I don't see that part that, I guess maybe there's another page here. Hold on. 4, 5, 6, no, there's only 7 pages. See, the thing is I have a Oh, there you go. There's the answer right there. It's on page 2. Let me get page 2 back out again. Oh, that's a different. No, that's right. That's the document. I guess we missed this page here. Summary, the key page. Hey, I'm glad I missed it though, because now I got to read all the rest of it before this one. Summary and opinion. According to the investigative history as available to me, and that provided by the detectives at the time of examination, the decedent was reportedly complaining of chest pain and shortness of breath for approximately 1 week prior to being found unresponsive on the bathroom floor on 12/12/2019. He was transported to a local hospital where death was pronounced shortly after arrival. According to his wife, the decedent had no past medical history and was not taking any routine medications. The decedent's wife reported the decedent had complaints of burning in his chest and shortness of breath since Friday, 12/6/2019. So just 1 week after they get married. Really? Okay. Law enforcement also relayed they have an open investigation involving the decedent. Based on the autopsy findings and investigative history as available to me, it is my opinion that Alexander Lamar Cox, a 51-year-old male, died as a result of bilateral pulmonary thromboemboli. Let me look that up. Hold on. That one I'll look at because that's what we're looking at. Thromboemboli. Oh, emboli. Okay. So it's thromboemboli, I think is how you would pronounce that. But let's see. They're blood clots that travel from the site where they formed to another location. It is not uncommon for blood clots to originate in the legs. Deep vein thrombosis is the term used to describe a blood clot that forms in a deep vein in the legs. So he believes that blood clots form somewhere, and let's see, with contributing factors of atherosclerotic and hypertensive cardiovascular disease. So I guess he's just saying, he had heart conditions, and then these blood clots, they probably got trapped because of the cardiovascular disease. It got stuck easier, the clots, perhaps. So he put down the manner of death is natural, as with all death investigations. So let's see. I mean, it is possible, because a lot of us have thought it was weird that he would, he wouldn't exactly kill himself, but then it was also strange that Lori and Chad weren't even in town when he died. So we'll have to see, but it's just the timing of everything. It just doesn't make sense. He dies the day after Tammy's body is exhumed, and then 1 week after he's married, just like all the other husbands. From Carmitis, yeah. Well, let's just wait for the toxicology, the deep toxicology report. Okay, because that's going to be, I'm sure it wasn't done on this one. It looked like, this is cut and dry, So, and I don't even see anything mentioned on here on toxicology. Yeah, it's hard to know for sure, but the timing of it to me is still very suspicious. I will say that on the 911 call, now let's listen to that again. All right, I think that's worthwhile to listen to. Hold on.
Hi, I need an ambulance to... Yes.
Why do you need an ambulance?
I have a older male, a middle-aged male.
I'm not
He is
sure.
breathing?
A blood clot.
Yes, he's breathing, but
Wow.
very highly breathing.
Okay, let me transfer you to Mesa, or the medics. Do not hang up.
Okay.
Is it this due to a
Fire and
overdose
medical,
or
what is
anything?
the address of your emergency?
Yes, that's correct.
Okay, what is the emergency?
I have a older male here named Alex. He just passed out here on my bathroom.
Okay.
I do think that Zuline Pastines, I think that's her name. I think she does sound kind of panicky, and, in the favor of it not being something she was involved in.
Is he awake right now?
I think he's passed out.
Okay, you think he's unconscious?
Yes.
Okay. Is he breathing normally, like you can see his chest rising and falling?
I hope so.
I have the paramedics on the way, but
I hope so. How about yes or no?
need you to try to help me with some information while they're driving there to help him. Okay?
Okay.
How old is he?
He seems to be in his 40s.
Okay. Do you know him?
No, it's my mother's boyfriend.
You mean your dad?
Okay. And how old are you?
I'm 25.
Okay. I have the paramedics on the way, so he's in the restroom right now.
Okay.
Gilbert, can we get you started?
I'm already en route.
All right, thank you. Okay. Is he on his back or on his stomach? Where is he at?
He's on his side.
Okay. Can you lay him flat on his back on the ground?
I'll try. It's just there's feces there, and I'm trying to just keep cool right now.
You said he's what?
There's feces on the ground.
Okay. I know that's gross, but if we can just go ahead and get him flat on his back, I want to make sure he's
Right.
breathing, because if he's not, we're going to do a few things.
Did you say he's cool, like cold?
Alex. Alex. Alex.
No, like he's cool, like man, you're so cool, dude.
We gotta get you on your back.
Does he seem more awake or more asleep?
He's more passed out.
Okay. Is he opening his eyes or moving at all?
Well, if he's passed out, how come you're talking to him?
He's breathing.
Okay. Is he breathing normally, like his chest is rising and falling? He's not making any weird sounds?
Yeah, he's making a very exhale sound like...
Okay. If he's doing that, we need to start CPR, so I need you to get him flat on his back on the ground.
Okay.
Okay.
I don't think I could do that, man.
I know this is difficult, but you're only helping him, okay? I know, the
I don't
paramedics...
think I could do
What
that.
is your
I have
name?
anxiety and...
Yeah, a lot of times, John, after you die, you get you'll urinate or defecate because your body isn't in control at all anymore. It just evacuates itself. So, I think you can have the same thing happen if you're passed out. I think that's a lot of times why you don't eat for 24 hours or something before surgery, things like that, because you're not conscious, so your body might actually defecate or urinate when. Let's see. So.
Depression.
Okay, what's your name?
At least that's my limited
What
knowledge.
is your
from
name?
My family of doctors.
My name's Joseph.
Joseph? Okay, Joseph. The best thing for us to do for him right now is to... So if you'll just take... I know it's not ideal, but you're doing a really good job by helping him if you can do that, okay?
That would be pretty brutal for that kid. Think about it. Barely knows this guy. He's got to do actual CPR. And
Alex. Alex. He's not breathing. No, he's too big.
Okay, just try to get him on his back so we can do chest compression.
My mother just got here.
I don't think
Okay,
everybody does
give her the phone
the
then.
death rattle. That's like the... So here comes the wife, comes home now.
So, did she say the mother just got there?
Yeah.
Come here. Come here.
And we're coming on Mineral right now.
Really
We're
bad.
almost there.
It's really bad. Come upstairs. In the bathroom. We need to get him on his back.
Can you put your mom on the phone?
She's right here. You're on speaker.
Okay, ma'am, the paramedics are pulling up, but in the meantime, we need him to get flat on his back, and we need to give him chest compressions, okay?
Chest compression. Wait.
Hey, Humanimal, just calm down a little bit. You're just all over the place. Your comments are just crazy. You know, first you said blog instead of blood. Now you're freaking out. Like, why is this kid upsetting you? This is just a 911 call. Just listen to it, okay?
Does she know how to do CPR?
Yes. She knows how.
Okay.
How far are you?
We're pulling up out front right now, so they're grabbing their equipment and they're coming in. Are you on the first floor or the second?
We're on the second floor.
Second floor in the bathroom?
Yes.
Okay, and the door is unlocked?
Yes. Yes.
Okay, do you see the paramedics now?
Yes.
Okay, Joseph, you did a good job. I know that was really scary, but thank you for your help, okay?
Joseph, before you hang up, I need your last name.
Okay.
Joseph, let the paramedics do their business and tell me what your last name is.
Lopez.
Joseph, what's your last name?
Lopez.
Okay. And what's your date of birth, Joseph? Alex's last name.
I don't know.
You don't know his name?
No.
Okay.
Yeah, he doesn't know his stepdad's last name. That's pretty crazy. But that just means how weird this whole situation is.
Alex's last name.
I don't know.
You don't know his name?
No.
Okay. All right. Do you let the officer in?
Yeah.
Okay. Sounds good.
Yeah, so let me get to the part where
He's not breathing.
the dogs
No,
are barking.
He's too big.
Okay, just try to get him on his back so we can do chest compression.
My mother just got here.
Okay, give her the phone then.
So, did she say the mother just got there?
Yeah.
Come here. Come here.
And we're coming on Mineral right now.
There's
We're
two
almost
women
there.
on the phone.
It's really bad. Come upstairs.
One's
In the
the
bathroom.
ambulance.
We need to get him on his back.
Can you put your mom on the phone?
She's right here. You're on speaker.
Okay, ma'am, the
Well, when they got married, Alex changed his name to her last name.
paramedics are pulling up, but in the meantime, we need him to get flat on his back, and we need to give him chest compressions, okay?
Chest compression. Wait. But
Does she know how to do CPR?
yes.
So you can hear in the background, Humanimal. We've listened to this 1,000 times on this show already. Okay, so you can hear she's saying, yeah, I know how to do CPR.
Does she know how to do CPR?
Yes. She knows how.
Okay.
How far are you?
We're pulling up out front right now, so they're grabbing their equipment and they're coming in. Are you on the first floor or the second?
Who's calm? I don't think either Pastines, what the hell do you say that? Zulima Pastines or the son are calm whatsoever.
We're on the second floor.
Second floor in the bathroom?
Yes.
Okay, and the door is unlocked?
Yes. Yes.
Okay, do you see the paramedics now?
Yes.
Okay, Joseph, you did a good job. I know that was really scary, but thank you for your help, okay?
I swear to his name is
Joseph,
Joseph.
before you hang up, I need your last name.
Okay.
Joseph, let the paramedics do their business and tell me what your last name is.
Lopez.
Joseph, what's your last name?
Lopez.
Okay. And what's your date of birth, Joseph? Alex's last name.
I don't know.
You don't know his name?
No.
Okay. All right. Do you let the officer in?
Yeah.
Okay. Sounds good.
See, what was weird though is like there was defecation on the ground. He wasn't dead yet, But it sounded like he was foaming at the mouth and rolling around in fecal matter and urine and stuff like that. I don't know if maybe he wasn't conscious at the time. Maybe that's what the deal was with that. You guys want to listen to that one more time, or is that good?
911, where's your emergency?
Hi, I need an ambulance to...
They were freaking out, Brandy. I mean, the first part of this call doesn't sound like that, but...
Why do you need an ambulance?
I have a...
See, here's the thing, is this guy, this kid here barely knows the man that his mom just married. So he's not going to be all panicky sounding. What he panics the most about is the fact that she's trying to get him to do stuff that he's totally uncomfortable doing and doesn't really want to do it. Like, would you want to give mouth to mouth to some guy you barely saw him walk into your house sometime? It's just, and that's what he was panicking about. If it was his own mom, he would be panicking in a different way. Now, Zulema, she was panicking like, Alex, they just got married a week prior.
A older male, a middle-aged male.
He is breathing?
Yes, he's breathing, but very, very highly breathing.
Okay, let me transfer you to the medics. Do not hang up.
Well, I'm sure he did. Humanimal, I'm sure he did.
Is it just due to a fire and medical?
Wait, Humanimal, are you going to sit here and try to say that this kid has something to do with it? Is that what your angle is? Because every one of your comments seems to be leading to that. Is that what you're going to do? Well, tell you what, go do that somewhere else, okay? I'm not interested in your opinion on that, okay? Go do oh, wait, this kid has something to do with it. I'll tell you what, I would have done. Okay, don't do any of that stuff. Okay, good. All right, but if you are doing that, because that's what you sound like, you animal. Like your comments are questioning this kid who doesn't even know this guy. So that's up to the mom and Alex for him not knowing. Okay.
What is the address of your emergency?
You definitely seem to be kind of going down that road.
Yes, that's correct.
Okay, what is the emergency?
I have a older male here named Alex. He just passed out here on the...
Yeah, he's passed out. He has poop on him.
Okay, is he awake right now?
I think he's passed out.
Okay, you think he's unconscious?
Yes.
Okay. Is he breathing normally, like you can see his chest rising and falling?
I hope so.
I have the paramedics on the way, but I need you to try to help me with some information while they're driving there to help him. Okay?
Okay.
How old is he?
He seems to be in his 40s.
Okay. Do you know him?
No, it's my mother's boyfriend.
Okay. And how old are you?
I'm 25.
Okay. I have the paramedics on the way, so he's in the restroom right now.
Okay.
Gilbert, can we get you started?
I'm already en route.
All right, thank you. Okay. Is he on his back or on his stomach? Where is he at?
He's on his side.
Okay. Can you lay him flat on his back on the ground?
I'll try. It's just there's feces there, and I'm trying to just keep cool right now.
You said he's what?
There's feces on the ground.
Okay. I know that's gross, but if we can just go ahead and get him flat on his back, I want to make sure he's breathing, because if he's not, we're going to do a few things.
Did you say he's cool, like cold?
Alex.
No, he's just saying he's cool right now. He's on his side.
Does he seem more awake or more asleep?
He's more passed out.
Okay. Is he opening his eyes or moving at all?
He's breathing.
Okay. Is he breathing normally, like his chest is rising and falling? He's not making any weird sounds?
Yeah, he's making a very exhale sound like...
Okay. If he's doing that, we need to start CPR, so I need you to get him flat on his back on the ground.
Okay.
Okay.
I don't think I could do that, man.
I know this is difficult, but you're only helping him, okay? I know, the paramedics...
I don't think I could
what
do
is
that.
your
I have
name?
anxiety and depression.
Okay, what's your
Anxiety
name?
and depression, I can't.
What is your name?
You can tell he's freaking out now.
My name's Joseph.
Joseph? Okay, Joseph. The best thing for us to do for him right now is to... So if you'll just take...
I wonder why that's cut out like that.
I know it's not ideal, but you're doing a really good job by helping him if you can do that, okay?
Oh.
Yeah, he's like, ah, God.
Yo, Alex.
Jesus. Ugh. Yeah.
Alex.
Yeah, man, I could totally...
He's not breathing. No, he's too big.
Okay, just try to get him on his back so we can do chest compression.
My mother just got here.
Okay, give her the phone then.
So, did she say the mother just got there?
Yeah.
Come here. Come here.
And we're coming on mineral right now.
Really
we're
bad.
almost there.
It's really bad. Come upstairs, in the bathroom. We need to get him on his back.
Can you put your mom on the phone?
She's right here. You're on speaker.
Okay, ma'am, the paramedics are pulling up, but in the meantime...
So, I mean, it sounds like he didn't actually end up putting him on his back, but he was trying CPR when he was on his side. I don't know how that would work.
We need him to get flat on his back, and we need to give him chest compressions, okay?
Chest compression. Wait. But
Does she know how to do CPR?
yes.
Well, this is before there was any COVID-19 that people were talking about.
You don't tell.
Okay.
How far are you?
We're pulling up out front right now, so
See, she knew that she actually knows how much danger he's in. She's saying, "How far are you?"
How far are you?
we're pulling up out front right now, so they're grabbing their equipment and they're coming in. Are you on the first floor or the second?
We're on the second floor.
Second floor in the bathroom?
Yes.
Okay, and the door is unlocked?
Yes. Yes.
Okay, do you see the paramedics now?
Yes.
Okay, Joseph, you did a good job. I know that was really scary, but thank you for your help, okay?
Joseph, before you hang up, I need your last name.
Okay.
Joseph, let the paramedics do their business and tell me what your last name is.
Lopez.
Joseph, what's your last name?
Lopez.
Okay. And what's your date of birth, Joseph? Alex's last name.
I don't know.
You don't know his name?
No.
Well, no, he's got your mom's last name.
All right. Do you let the officer in?
Yeah.
Okay. Sounds good.
Yeah.
Where's your emergency?
And there's the...
I need an ambulance to...
What is that? Snow remover? Hey, thank you, snow remover.
I try to send you a link to Autopsy with Toxicology reports from Justin Lumore. Just check his Facebook page for it.
Does he have the toxicology report, that the newer one, or just from the original autopsy? Anyways, here's the marriage certificate right here. See, it was November 19th. And then down here, where is that? Where he changes his name? Yeah, Zulema Pastines and Alexander Lamar Cox. And it says right there, who wishes to use the name Alexander Lamar Pastines after the marriage. So he's taking her last name. All right, let me check this out. Yeah, I have the link in the description. It's Fox 10 Justin Lum. He put out all this. Has not been released yet? Oh, that was earlier. Well, yeah, that's what the original autopsy said. Okay, right here. Oh, I thought we already went through this. Oh, there you go. What page is that? I don't think I have that page.
Thanks for the update, Grey. Grinning face with big eyes.
Hey, thanks, Lily Mel. Okay, let's get to that now. So caffeine, potassium. I'm not sure what the regular levels are. So you had caffeine and nicotine. Potassium. I know that can cause issues with heart irregularities. But I don't know if that amount's probably normal. It doesn't say anything. Let's see. Doesn't sound like any other... I don't know, what do you guys think? Looking at it, if you're a doctor or nurse out there. So you did have caffeine and, well, not nicotine. It says naloxone. I thought that said nicotine from far away, now that I look at it close. It says naloxone. Not sure what that is. Let's look up that. Oh, it reverses an opioid overdose. I wonder if they thought that that's what he had, quickly pumped it into his system, and then it showed up in the autopsy report. You think that's possible? Man, my screen just went haywire. There he is. Okay, yeah, that makes sense then. They probably were just trying everything at that point. I mean, they did do toxicology, but I wonder if there's certain drugs you have to specifically test for. Like, they probably just put your blood in and it spits out these, right? Let's see, what is the normal blood level of creatinine? It said 0.6 to 1.2. Well, he's at 1.6. A little bit higher, I guess. Sodium. A normal is 135 to 145. He's at 131, so a little bit low, but barely. Potassium. It says normal range of potassium is between 3.6 and 5.2 millimoles. And that's what they're using. He has 13. So that's double, almost triple the potassium level there of normal. He's at 13. It's 3.6 to 5.2. And then but I don't know if that's like a lethal amount, you know. Definitely 3 times higher than normal though. Chloride, he's a little bit high, not that high though. And then normal levels are 96 to 106. He's got 135. And then normal urea nitrogen levels 7 to 20. He's got 22. So, I don't know. Doesn't really seem like there was much in there. Yeah, I don't know. Yeah, definitely a high level of potassium, and that does affect your heart, like I was saying earlier. So, I don't know, though. Is that, like, way high in the medical community? I mean, if somebody, wow, that's so high. You know, do you get that after eating a couple bananas, let's say? You know. Yeah, so he was 13. Well, but it sounded like his kidneys were fine. All right. Well, I think that's about it for the update on that. Later, I'm hoping to have updates because we had Cairo went out to the crime scene area of the Stephanie and Paige case that we've been covering, and you can really see the area way better. He was down there, so there's actually like a vigil of a few people there, some of Stephanie's friends. Thanks, Ava Lynn. Yes.
Best true crime show ever. Thanks, Gray.
Well, thank you. Appreciate it. It was really windy. He did get some drone shots too, but it was very windy, but he still got some. It really shows you exactly. It's pretty amazing. It's the car basically did not try to stop at all, and just flew right into. And it went over, you know that sign that said, like weddings or something on it? Went right over that sign. It might have, I think it might have even hit the sign because it's not there anymore. However, there was no, it wasn't sitting around, you know, the sign wasn't sitting around, but I could see the hotel, or not the hotel, whatever facility that it was, picking up the sign and taking it away. Yeah, well, we don't really know yet, Harlow, because that was the autopsy done the day of, you know, that he died, basically. But they may have went back and re-looked at some things, given what went on here. So there might be a next autopsy. You know, another version of it. Just basically, the same thing would have happened in Tammy's case, had they actually done an autopsy to start with. But they didn't do one. Okay? So now they're doing an autopsy on her after the fact. And I think they might have done the same thing with Alex here. That doesn't sound too fun there, Grandma Bengalis. That's the one I really want. I haven't heard that one back yet. Chris 22. I think that one's coming out sometime soon, though. But anyways, thank you guys very much. I am now going to be going to do something else right now. But I had to get that out there because, man, that's something we've all been waiting for. And the initial autopsy showed it was natural. Let's see if anything came later, if they retested his blood for anything else, anything known. And it might have been somebody, you know, maybe it was known that he had something wrong with him, and they used that because it's kind of similar, if you think about it, to Joseph, right? Joseph Ryan. You know, he had the heart issues, and then all of a sudden he dies too, one of Lori's other husbands. And did she have anything to do with that? Who knows? So thank you very much to Jerica Killy, snow remover. I think we're past that time of year. You might want to change it to something more like leaf raking. Kevin Brown, Lenny K, and then snow remover again. Thank you very much. And then Lily Mill. And thank you for getting me updated on that snow remover. I went and got the toxicology based on what you said. Lily Mill and Ava Lynn. Thank you very much. I appreciate it. All right. Hey, if you're still there, John Crimes, you got to check out my ending of the show rap that I made with a dancing Lori Daybell. So I think I'm going to cut right to that, actually. I'm not going to do my normal closing. But here is Lori Daybell dancing to my show's rap. All right. Hey, thanks, Linda Howe, as in Linda Moldenhow of the Cattle Mutilations. All right. So thank you guys very much. I'll be back on later. So until next time, be safe out there. Yeah, I've been doing this true crime thing for quite a while now. And during this whole time, I have not seen one person that is a crime dissector, flag rejector. I'm a certified human lie detector. Gonna get ya on a stretcher if you try and play me like an old projector. Crime sector is my nectar. Professor Gray is gonna give another lecture. Crime collector, freak connector, and I'm always gonna be a pup protector. Fool deflector, interceptor, and I'm meaner than a spectre with a vector on his pector. With all respect, y'all, just remember I've a temple fucking check ya. I have no agenda, I'm no pretender, and I'll serve it to you straight without the blender. And in the end, I'm gonna send ya on a mission to reveal the true offender.
All right, Lori, go Lori.
So let's get right back to work. All right, everybody. Talk to you.
All right, we'll see you guys a little bit later.
Yeah, we sure will, Mary Lou.
Well, thanks, John Boy. See you later.